Perfect. Welcome, everybody. Good afternoon, good evening, good morning from wherever you're joining. I'd like to take a few minutes to introduce Iain, though he's already done that. Iain McCormick is the founder of Executive Coaching Center in Auckland, New Zealand. He's trained in clinical psychology, subsequently completing a PhD in work stress. He has been consulting and coaching for over 30 years, working in Canada, Hong Kong, and New Zealand, and has conducted over 12,000 individual and team coaching sessions in the last 30 years. And he has been conducting schemas coaching sessions for the last 10 years. He's a productive author with over 100 articles and book chapters, plus 4 books, one of which is Schema Coaching, Overcoming Deep-Seated Challenges, on which the session today is based. Now, schema therapy is a highly successful approach for helping clients with a range of mental health disorders. He has adapted this approach that was originally used with the clinical population for the use with coaching clients. He presents his approach in 2 parts. For the first is primarily designed for coaches that do not have clinical or related training. And second includes more advanced techniques, which are designed for coaches with clinical training and qualifications. You can map the learnings from today's session to competency number 8, which is facilitating client growth. Now I'd like to invite Dr. Iain, and over to you.
Thank you very much indeed for this opportunity, and good afternoon to everybody. I'm delighted to be here talking about schema coaching and how it can be used with persistent and challenging dysfunctions. So I'll just share my screen. So just a little bit about how I got into this area. As you know, I trained originally in clinical psychology, and I have over the years been referred a lot of clients who have some really quite difficult problems. And some years ago, I was referred a client who had a very, very strong sense of perfectionism and who was extraordinarily hardworking and who was really at the point where she was starting to frustrate her boss, her team members, her customers, and herself and her family with this really consistent kind of problem. It really came to a head one day when she actually missed her daughter's birthday because she had an urgent matter at work and she was working away. And that really gave her a big shock that this had happened to her, and she decided she really wanted to do something about it. And at that time, I was using a mixture of solution-focused coaching and using acceptance and commitment therapy approaches in coaching. But I really felt like those were not going to deliver what I wanted. And so I started looking around for something else. And I came upon schema therapy. And just to give you a little bit of background, the idea of a schema in this context, and its full name is typically an early maladaptive schema, is that it's a very persistent and organized pattern that starts early in life, and it's a set of beliefs and ideas that have a profound effect on someone's life. So it can either be positive, so there's a lot of good schemas in terms of a sense of stable attachment and emotional fulfillment, but there are also lots of negative ones. So a very common thing that we see in coaching is what's sometimes called imposter syndrome. So it's really the idea that despite what someone has succeeded in so far in their career, they fear that they will at any moment be found out. They fear at any moment they will be discovered to be a fraud. So these kind of beliefs that percolate people's lives and cause them an awful lot of difficulty. So schema therapy was developed by an American, Dr. Jeffrey Young, and he originally was a Gestalt therapist, and he found Gestalt therapy very useful for a lot of people who had Axis 1, so kind of neurotic type disorders. However, he discovered that it was not so successful when he was working with people who had personality disorders. And he really started searching around for what he could do to deal with people with these much more persistent emotional volatility kind of problems. And he decided that many different types of therapies offered something. So psychodynamic offered the ability to look back and to understand why something had happened. Cognitive therapy, behavioral, mindfulness, all of these things offered different approaches. But at that time, many of these therapy modalities were almost at war, where they were trying to prove that this is the best therapy type and it's superior to yours. And he really came up with this idea that if we could have an integrated approach across these different therapies, we could actually take various parts of them and use them to deal with these underlying problems. And one of the ways he integrated the various therapy types was to have a common language of early maladaptive schema. So these are the kind of persistent beliefs that people have that are dysfunctional, how they cope with those, and then the mood states that are generated by the schemas. And we'll talk about many of those areas as we go through. But where do these schemas come from? Well, the idea here really is that there are very basic human needs which all children have. Need obviously physical needs in terms of food and warmth and so on, but psychological needs as well in terms of acceptance or empathy or love and so on. And if those early needs are not met, people start to develop beliefs that are not very helpful. So, for example, I worked with a client who had a brother when he was very young who was very sick. And his parents really devoted all of their time to dealing with the sick brother. And what that meant is that my client really um, lived for many years of his formative time in life feeling like that somehow he wasn't good enough. He was a failure. He wasn't accepted. He didn't have the kind of love that he really wanted. Now, it was no one's fault. It was very understandable. He could understand himself very well that actually his parents needed to look after his brother. But he just came to feel that fundamentally there was something wrong with him and he was unlovable and he was a failure. And although he became very successful in life, at one point he went through a crisis, and this kind of belief really became very prevalent in his life and very problematic. So these are early childhood needs that are thwarted or not met that lead to these maladaptive beliefs, or if they are met, they can lead to positive schemas, and we'll talk a little bit more about them. Now, one of the things that I found when I got into schema therapy is it's very, very complicated. So if you can imagine a three-dimensional matrix, so on one level we've got schemas, and in the original version of it, there's about 20 of those. There's three on the next side of the matrix. There's three coping mechanisms and 11 different modes. So you can imagine a 20 by 3 by 11 matrix. It's enormously complicated. And what I felt about it was that for us as coaches who are dealing with high functioning people, many of the schemas and coping mechanisms and even many of the modes are not relevant. So you can see in this diagram, what I've tried to do is to draw out what I've seen as the common schema we see in coaching, and then to just leave on the other side the schema that we typically see in therapy, but we wouldn't see so much with high functioning people. So you can see there, unrelenting striving, sense of failure, need for approval, and so on are very common things that we see in coaching. And then over the last few years, people have become very much more interested in positive schemas. And of course, as coaches, we're solution focused, we're forward looking, we're positive. So these are very useful to us as well. And so there's a whole series of these which are very relevant in schema coaching. So we have schema, which are very deep-seated, long-standing problems. But we also see, and it's particularly so in therapy with people with personality disorders, but we see it in coaching as well, where people move through different mood states. So someone might have a very strong, unrelenting desire to work and work and work, and they feel like the only solution to life's problems is to work harder. And they might come into a coaching session and feel maybe quite sad about that. And then maybe halfway through, their mood changes and they start to become frustrated and angry at themselves. So these mood changes, or what in schema therapy is called mode change, are mood changes we see in the session. So there's healthy adult, there's child modes, and there's maladaptive modes. I apologize for going quite quickly, but you can see there's an awful lot in here. Uh, and so what I did really was I took what I saw as the most relevant aspects of schema therapy and took out a whole lot of those which I thought were really most relevant for the non-clinical population. So we focus on both positive and negative schemas. And the type of schema coaching I've developed can either be, as we heard before, it can be used by coaches who are not clinically psychotherapeutically trained, but as well as other techniques that are more suitable to those people. So it's really a kind of a simplified approach. But the goal of schema coaching is exactly the same as the goal of schema therapy. So we're really trying to help people to get their core needs met. So those needs for love and for consideration and for boundaries and for all sorts of things that people missed out in their very early years. We're trying to use a whole range of techniques to really build a positive person who has these old archaic needs met. One of the other things that I did was, again, as I've said before, schema therapy is very complicated, and I wanted to have a kind of a simple way for people to think about schema and the components of it. And one of the things that people who know the work of Russ Harris and Stephen Hayes in acceptance and commitment therapy, they've got a hexagon. So I really like this idea of having a geometric figure and then fitting the elements of schema around it. So it's what I've called the schema octagon. And I just want to talk for a minute about what's in the center of the octagon. So one of the things we do in schema coaching is we are empathetic, and the relationship is important, just like in any coaching. But in schema coaching, we're trying to go that much further, because what we're trying to do is to help the individual to deal with and heal that unmet need. And we call that process limited reparenting. And what that means is that we're really trying to provide the person with the sort of care and attention that they didn't receive as a child. You can see that in some of these around the octagon, they're in italic and lighter text. Those are the ones most relevant to non-clinical coaches, and the other three are for clinical coaches. And we'll go over those in a little bit more detail. But I just want to start with something I think is very important. Obviously, ethics are essential under these circumstances. And if you are going to think about using schema techniques, then what I've developed is what I call the ethical 8. So here are 8 steps that I think anybody who's going to get into these areas needs to be thinking about and be able to tick off. So obviously you need formal training in coaching and coaching for yourself. So that's kind of obvious. I'm sure you all fit into that category. Next, you need some sort of formal training in schema therapy, preferably schema coaching. And I'm going to talk about a certificate course that I've started up. but you also need to undertake some kind of schema therapy or schema coaching for yourself. And so I have had a couple of schema therapists, and I found that work dealing with my own personal issues to be extremely helpful. You need to have ethical standards, and I'm sure you do. You need to screen for high functioning clients to make sure that if you're doing this kind of work, you're not stepping in and working with people who really are in the clinical population rather than the coaching population, and supervision and professional development. So these are the techniques for non-clinical coaches. So schema has a really useful and very effective case conceptualization that is really quite different to a lot of the case conceptualization that we might do as coaches. In particular, what we do in the case conceptualization process is we very often ask the client to talk through their life from their ancestors, from their grandparents, from their parents, from their very early childhood, right the way through, taking maybe an hour, maybe 2 hours to really understand the underlying patterns that we see. So if we see someone who comes to us with a sense of failure, we will often see 4 or 5 or 6 or 7 different instances where maybe at very early on, one of their parents was very sick for a long time or was depressed or something. We may see failure take place at school and at university and so on. So case conceptualization is really understanding the nature of the problem and where it came from. Schema psychoeducation is teaching people about schema and modes primarily. And then there are a range of really useful techniques. So there's a lot of mindfulness-based techniques to help people get in touch with their healthy adult, to deal with their vulnerable child, to deal with their inner critic, and so on. There are schema draws upon cognitive behavior therapy. So there's a really very nice schema challenge process that is part of schema therapy. And I'll go over that in a little bit more detail. And lastly, I like to teach coaches relapse prevention. So towards the end of our coaching work, how do we look ahead to predict difficulties and develop an approach to minimize the impact? Just by the way, and while I think about it, please interrupt if you've got questions as I'm going through. You'll find I'm not easily put off. So if you've got a question about some of these things, please just speak up, raise your electronic hand or your physical hand if you've got your camera on. So I talked before about the schema challenge process, and this gives you a little diagram of it. So if we've got someone who comes with, we'll stick with a sense of failure as an example, they might come to the session, and what we might do is say, okay, so you have this ongoing sense of failure. What was a situation that arose in the last few weeks when this sense of failure was very strong for you? And they might say, well, I had to give a presentation to the board of directors and I was extremely nervous in starting this. So the situation I want to work on is giving a presentation to the board of directors. And so then I would ask, well, what's the emotion you feel? And I'd ask them to describe that in one word, because many people, when you ask them what they felt, they tell you what they think, but we're really interested in emotion. So we're interested in sadness or frustration or anger or shame or whatever. And then we ask them what the trigger for the emotion was. So in this case, the trigger was, well, I had to get up in front of the board. I thought they might be critical of me. I thought they might ask me questions that I couldn't answer. So I became more and more nervous. And then you can ask them, okay, so you're in this situation, you're a very successful executive, but now when you're giving this presentation, you feel nervous. What kind of underlying belief, what kind of schema do you think is operating that's telling you or you're a schema in which you're telling yourself, well, I think I'm going to fail. I could fail. They'll find me out. It was only luck that I've got this far, etc., etc. So then we work out, well, how does the schema distort your thinking? Well, the schema distorts my thinking because whenever I get into the situation, I've kind of got this inner critic that's going, this probably won't work. They'll see through you, etc. So the schema, this belief, distorts their thinking, but actually they know that the reality is they've probably done this before. They are very successful. So we get to the point where they can say, okay, even though I feel scared, even though I feel like I'm going to be found out, what I'm going to do is get up, I'm going to speak in a loud, strong voice. I'm going to use the slides and look at the slides. I'm going to find a friendly face in the audience, all of the techniques we know for giving good presentations. And then we work on homework. So, okay, so how could I give a few more presentations? So those of you who are involved in cognitive behavior therapy will see the very clear underlying element of how in schema we use cognitive behavioral approaches. But of course, it's integrated because we're using them to deal with schema challenges. So there are lots of other techniques. These three are really for coaches with clinical training. And I'd be interested to ask afterwards if there are people in the meeting today who do have clinical training. But if you do, you'll understand the psychodynamic approach of regression, of going back, of understanding early painful memories. And imagery rescripting involves identifying painful memories, but then getting the person, and this is quite unusual, to go through those memories in the first person present. So they might start off, well, I'm a 5-year-old boy and my brother has just come into the bedroom and I fear that he's going to start bullying me. And so the person goes through the imagery, and the coach says, can I intervene and talk to your brother and talk to you? So in the live replay of the memory, the schema coach comes in and might say to the brother, hey, what are you doing? Leave him alone. And he might say to the child, hey, look, this isn't your fault. He's being mean to you, etc. So that's really a process of changing the nature of images. And there's some good research around the effectiveness of this. There's chair work for those of you who are familiar with Gestalt therapy, and emotional exposure for those of you who know about flooding and systematic desensitization and so on. So this is all really contained in my book, which is available towards the end of the year from Routledge. Unfortunately, it's still on pre-order. I had hoped that it would be out now, but it's not quite, but it's not far away. So if you're interested in this, you might be interested in getting hold of a copy. And on the basis of that, I'm running a 75-hour competency-based training program. And I've got two programs, one designed for coaches without psychotherapeutic training and one for. So I call the one for people without clinical counseling psychotherapy qualifications the certificate in schema fundamentals. And basically you can learn these techniques and go over them in much more depth. So that's really what I wanted to cover tonight. And I would be very interested in hearing if there are questions. And I would be very interested in asking you a few questions if there aren't too many. So, does anybody have a question or want to make a comment? I'd be very interested indeed to hear from you.
Yes, we have Piyush. Go ahead, Piyush.
Yes. So, Iain, lively, very engaging to hear all this.
Thank you.
So I have background in transactional analysis, and
okay, right.
A part of me was wondering, the chair work you described as a coach, is that regressing the client that you're doing there when you say, look, 5-year-old somebody? And I was wondering if that is okay in coaching. It's
Yes.
effective, I'm sure it is.
Yes. So I think that's why I raised so thank you very much. That's a really good question. That's why I raised this whole ethical issue. So one of the things that we know as coaches is that we need to stay within the bounds of our professional competence. So those sort of techniques, I would say, should really be only used for people who have clinical qualifications or who have had personal experience, gone to a schema therapist or schema coach themselves, been through it, really understand it from the inside, have training, have supervision, etc., etc. So they are definitely not the sort of things that I would recommend people do or try unless they go through that sort of path. And the process tonight is really just trying to outline and give you a sense of the richness of this. So if you are clinically trained, you can get into some of those. If you're not, there are still lots and lots of other things that schema coaching has to offer. Does that answer your question?
Yeah, I understand. So, so there are boundaries between coaching and therapy that coaching has had because of being the younger profession,
Yes.
but there's something
Yes.
that's more effective for a person, and you need to have background and skill to use it. That's what I
Yes. I
understand.
mean, yeah, I mean, I'd be interested in your view, but from my point of view, the difference really is the populations we work with. So we in coaching, we deal with people who are primarily psychologically stable, socially stable, and vocationally stable. Now, that is often not the case if the person is in therapy. And so we can use approaches and probably work at a speed that would not be appropriate in therapy. But of course, there are an awful lot of overlaps in terms of the approach and the techniques we use. And coaches have used cognitive behavior therapy and acceptance and commitment therapy for years and years and years. And I'm sure your own work in transactional analysis, I'm sure, has been extremely valuable.
Yes, agree. Thank you.
Thank you.
Go
Hi.
ahead, Nagesh.
Yes, it was very informative session. In fact, I was more excited to listen because the reason is I just recently get into the psychology field. I'm a counseling psychologist also.
Right. Okay.
So my question is, what's your definition when you mention as a clinical coach? I mean, how do you define that?
So what I'm thinking of is people, and the qualifications vary, but essentially, clinical qualifications are either people have a master's degree and typically a diploma in clinical psychology, which involves a year of practicum and supervision, or they have a doctorate in clinical psychology. For counselors and psychotherapists, those people are typically trained at a master's level and then they have supervision. So essentially, when I use that term, I'm talking about people who hold a tertiary degree in clinical psychotherapy or counseling psychology.
Sure, sure. Thank you.
Maybe we can just have take your wonderful question. So, are there people in the audience that have clinical qualifications? Maybe you could just put up your hand if there are. Can't see any hands.
Yeah,
Oh, a few. Yeah.
I don't have a
Okay.
master's, but I'm a certified transactional analyst. I
Okay.
was,
Wonderful.
yeah,
Wonderful. Yeah. Okay. So that's kind of what I thought. If you look at most ICF populations, you've got a few people in that category, but most people have come from other backgrounds, and I think that they can bring a lot of richness, even though they're not bringing those psychotherapeutic skills.
Yeah. And if time permits, can I ask my second question? Yeah.
Sure.
Is there any origin from CBT? Because I recently attended a couple of live demos on CBT as well recently. I mean,
Yes.
is there in the schema coaching, is there any origin or maybe some concepts brought in from CBT? Because the moment I
Yes.
saw the diagram, the outcome based. approach. Yeah.
Yes, absolutely. So yes, you picked that up absolutely accurately. So one of the therapy types that Schema has integrated is cognitive behavior therapy. So those that process of Schema challenge fundamentally uses a cognitive behavior therapy approach. But the wonderful thing about Schema is that it uses a whole lot of other approaches as well, but all integrated around this idea that we're going to give the person a range of tools to deal with their schema and with the dysfunctions that they have. So absolutely, you're right. Schema draws upon cognitive behavior therapy, and if you were going to get into schema, you would be using some of those skills that you have learnt.
Mm-hmm. Thank you. Thank you so much for answering.
Thank you. So was there someone else who had a question? You'll need to turn on your mic if you want to be heard.
Maybe you should ask a question that you had, Ian, for us.
Sure. So yeah, I mean, what I would like to do is just to find out. I'd be really interested to know just a little bit of what the people, the coaches. So there's about 30 or 40 of you here tonight. What are some of your backgrounds? So if you could either just put them in the chat, just well, I'm an engineer or I'm a software developer or whatever it is, that would be extremely interesting. Or if you want to come on and just talk about what your background is and what you see that contributes to coaching, I would be very interested to hear that. So a management consultant, very interesting. Okay, that's fantastic. So again, you can see how people with management consulting experience provide fantastic contribution to coaching because they're bringing that kind of understanding and analytic skills that are so important. Someone else from general managing, including sales, again, that's fantastic. L&D, that's a wonderful couple of L&Ds. Those are fantastic. And management and talent consultants. Okay, so someone with sociology background, fantastic. Finance, yep. Brand and marketing, engineering, wow. They've got a wonderful diverse range. Chemical engineering, higher education, OD, okay. IT, okay. There's an IO site, wonderful. IT industry, banking. Wow. Okay. Okay. So, and what are I'm interested to know, what are the modalities? What are do most of you use solution focused coaching or do you use the GROW model or are many of you into acceptance and commitment act type things? Or obviously some of you are into TA. I'm really interested to know what modalities of coaching you use. Again, if you want to put it in the chat or talk about it, that would be really interesting. Okay, so grow and solution. Yep. Solution and grow. Okay. Okay. TA. Oh, psychodrama. Wow. NLP. Okay. Grow. Yep. Okay, so the life coaching model. Yep. So that's primarily in terms of setting goals and helping people understand their values and working on that sort of basis is how I understand that. And how many of you are interested in developing more into the use of therapeutic skills? Just give us an idea again on the chat, just a yes or no. So if you're in the grow space or solution focused, okay. So immediately a number of you are in the yes category. Okay. So someone's saying they they were working with someone with childhood emotional neglect that led to the imposter. So again, that's exactly the sort of issue that might be dealt with through learning some of the schema techniques. Okay. No, that's very interesting indeed. And so people are very much interested in kind of expanding. Have any of you read about schema or been involved, read some of Jeffrey Young's work or not? Or is this presentation tonight largely new in the sense of not something you've come across before? So maybe just tell me, oh, there we are. That's a good response. First exposure, first understanding. Okay, no. Okay, new to schema. Okay, great. Okay, so it does overlap with TA, absolutely. Okay, so most of you, this is the first time. And if it's the first time that you've come across schema, what is it that makes schema different from what you've heard so far? Why do you think schema is different to the grow model or solution focused or something? What do you think is from what you picked up tonight the most important thing that makes it different? Any ideas?
May I invite people to speak
Yes, you certainly
on
can. That'd
this
be great.
question? Yeah.
We've obviously got lots of happy chatters, but we'd like to hear you as well. Okay, so that's interesting. Okay, so it's this idea that schema does, obviously, some of it is future focused, but it also has this element of looking at this function and understanding it in terms of the person's past. Okay, that's very interesting. Yeah. So all patterns that limit us often originate in childhood. So it seems to be directly addressing that. Yes, that's a very good understanding, and you can see how the whole idea of limited reparenting is really trying to work at this idea that we're trying to do more than just be empathetic and caring and concerned and building a coaching alliance. We're really trying to help deliver to the person a sense of care that might in some ways compensate for what they missed as in childhood.
We have Sudarshan.
Yes, Ian, thanks for the fantastic session. I have one question to ask. So,
Fantastic.
when the client reveals that client had, say, childhood sexual abuse and trauma around that, is the schema coaching applicable there?
So, to be totally honest, if I had someone who came to me and who came because they wanted coaching, but then later revealed that, I would I would talk through, I would be supportive, I'd be very interested to hear about it, but I would probably want to refer that kind of problem on to a psychotherapist or a counselor or a clinical psychologist. I don't see myself as being competent in that kind of area, and I would want to refer on.
Got it. Thank you.
But so that's the first part. The second part is, of course, if the person went to a schema therapist, then the schema therapist might do quite similar things to what a schema coach would do, but obviously they would be better trained in the area of dealing with early childhood trauma, etc., etc. So I definitely, as I'm sure you all know, I know the ICF has got some really excellent material on a fantastic booklet that I've read on when to refer on, and I think this is a sort of a classic example where I never would want myself to be dealing with that issue. I would see that as outside my competence, and I'd be wanting to refer on.
Got it. Thank you. That clarifies.
Just on that point, you raise a very useful point. I think one of the things that I do, particularly in the certificate of schema coaching, is I encourage the people who do it to actually get to know one or two psychotherapists, counselors, clinical psychologists, develop a bit of a personal relationship, go out and have a cup of tea sort of thing with them, get to know them a little bit, because in the case that they do need to refer on, it's very nice to be able to say to a client, look, I'm very happy working with you, but you've raised an issue that I'm not capable of dealing with. I know this other person. I've met them. I trust them. If you would like an introduction, then I would be very happy to make it. So I really encourage all coaches to try and create some connections with people in that space in case they do need to refer on, if that makes sense.
Yeah, definitely makes sense. Thank you.
Go ahead, Vicky.
Yeah, hi. Iain, this was really absorbing. And
Thank you.
to answer you asked a question, and I'm going to quote Carl Jung.
Right.
And he said, if you don't make the subconscious conscious, things are going to happen in your life and you'll call it fate.
Yes.
So the quintessence of my work revolves around what you've spoken.
Right.
Okay, so 3 quick points. You have a client coming with a problem, right?
Yes. Yes.
Now, how do you define a problem? The problem is arising because the client has a goal and he or she feels non-resourceful to achieve it.
Yes.
Only then
Yes.
it becomes a problem, right?
Yes,
You
exactly.
can have various modalities. I've been trained into various things. I'm, apart from the ICF coaching, I'm also a Gestalt practitioner.
Yes.
I have been into REBT, TA. These are all different modalities. But if you really
Yes.
ask me, the biggest challenge is to really differentiate whether it is to do with thinking or this deep-rooted schemas which have come from childhood modeling,
Yes.
or is there an underlying psychopathology
Yes.
that you spoke about?
Yes.
Because if it is impacting the neurobiochemistry and if it calls for medications, then obviously these things are not going to work.
No.
You need medications. Like, for example,
Yes.
I have a couple of clients and because nothing worked.
Yes.
Ultimately, I asked them to go for a psych eval, and I
Yes.
found that one of them was bipolar.
Yes.
Some had a borderline personality disorder.
Yes.
So the thing about schema, I'm familiar with that. But what is really interesting is that it is about restoration of empowerment or an agency in the individual,
Yes.
such that he becomes or she becomes an emotionally self-regulated human being,
Yes. Yes.
has the wherewithal to problem solve and have behavioral choices.
Yes. Yes.
So I can
Exactly.
use a gestalt, I can use XYZ, but then the real challenge is the diagnosis, even when you're coaching, because cognitively a lot of things are being spoken, but the conscious mind is so slow.
Yes.
And before you know, you're connected to the deepest schemas.
Yes.
So I do a
Yes.
lot of trauma work, by the way.
Yes.
So,
Yes. Yes.
so I can really resonate with a lot of things that you've spoken.
Fantastic.
Thank you.
Fantastic. Yeah. Thank you. And I totally agree with the point that you're making, which is that we as coaches need to be very careful about understanding which population we're dealing with. And very often people can come to us And after a session or two, we get a sense of, well, actually, I think that, this is a level of depression that I don't want to deal with, or this is a level of trauma which I think is beyond my capability, or this is, a degree of emotional volatility that may indicate a personality disorder. And I think, again, this whole point about that we talked about before, knowing a therapist, being able to refer on to a therapist is a critical thing for any coach. So yes, very good points you make. Thank you.
I want to
Sorry.
quickly add to this. There is a case I got who had been to various therapists and whatnot. And
Yes.
can you imagine? We spoke about ethics, right? Ethical bearing. And can you imagine one of the coaches or whatever you want to call that person actually said that I can cure you. You don't need
Yes, yes.
And after having a conversation, I realized this is falling in the clinical population.
Yes.
And when he was referred to a mental health practitioner, I mean, he was, put through various psych eval, including your MMPI, Rojak, and all these things. And we
Yes.
found out there was something deep.
Yes.
It was genetic. And when
Yes.
medications were given, after that therapy helped.
Yes.
So I completely
totally agree. Yeah, very, very important to be able to assess which sort of people we can work with and which sort of people we can't, and be able to refer on. And yes, I agree. I've had clients as well where medication has been a much better solution than solution-focused coaching, for example.
Absolutely.
Yes.
Thank you.
Thank you very much.
And there are some interesting comments by Mamta in the chat a little
Yes.
ahead. Do you want me to read them out?
Yes, thank you.
So she says, may also help addressing aligned issues rather than just the one being talked about. And she said she is reading part 2 of a book called Running on Empty, which talks on similar lines and has helped her with the participant that she supports, and also helped her understand a great deal about childhood trauma.
Yes. So I think those are both excellent points. I mean, I think this issue of we have clients who come in and who might talk about a boss that's unkind to them, or a team member who's being very unpleasant, or whatever it is. And of course, that is the situation, that is what they want to work on. But as you rightly say, there's often a lot of aligned issues with that. So this is probably something whereby the person has a particular sensitivity to some kind of behavior, and they pick up on that behavior very easily. So they're very inclined to see these difficulties in a situation where another person wouldn't see them. So yes, absolutely right that we often see these deep-seated issues popping up in all sorts of unexpected ways, and people who normally cope extremely well and are able to deal with all sorts of problems in life suddenly come across a problem they can't deal with. And suddenly they have a degree of grief or anxiety, or a real sense of doom about something which normally they would find very easy to deal with, because of course this situation represents and reminds them of that much deeper underlying issue. So fantastic points. Thank you very much. Was there anything else in the chat that you wanted to read out, or that people wanted to talk about?
There isn't anything else on the chat?
No, thanks. So I see there's some papers there which I can have a opportunity to download. Thank you for whoever put those on. That's much appreciated.
That's the resource, Ian, you mentioned of ICF resource. I just put it on the chat so people
Ah,
can.
wonderful. Okay, fantastic. And just to say, I've written lots of papers in this area. So if you would like to get in touch with me, and so I've written, I don't know whether whether many of you read the Coaching Psychologist. So that's the BPS publication. So I've had a number of articles in that. And I don't know whether you know the International Journal of Evidence-Based Coaching and Mentoring. So again, I've got articles in that, and if you'd like any of those, feel free to just send me your email address, and I will send you the PDFs if you're interested in reading that. There's quite a lot of stuff that I've written for those of you who want to explore it a bit more, and I'm very happy to share these kinds of things with you.
And are there any live demos where you facilitate the client using a schema coaching in terms of like?
So in the certificate of schema coaching, yes, we do live demos. So what the way in which I like to run courses is to do them in a very small format. So maybe 4 or 5 people in the class, that's it. And for people to develop a sense of trust and psychological safety in the group. So work a few sessions, just getting to know each other and so on. And then if someone has an issue, and for example, we're talking about mindful release, so using meditation and mindfulness techniques to let go of some schema pain, then we might do a live demonstration in the class for people like that. So people can actually work on some of their own issues in front of their classmates, provided they feel safe and provided they feel there is a good degree of confidentiality and so on. But I'm a great fan that if you've got a big audience, a bit like this, you need to do a presentation and talk about it. But actually, if you really want to learn, you need to be you need to experience it yourself. It's that experiential learning that is much more powerful. So yes, live demonstrations are very important. And thank you. That's my LinkedIn address, and I'd be very happy to have instant messages on that through LinkedIn if people want to contact me that way.
Sure, thank you.
Thank you.
There's a question, Ian, someone has sent to me directly. They ask, what situations, can we use schema coaching in? As in, when do we know that this is the
Right.
situation for schema coaching?
Yep. That's a fantastic question. So I, like most of you, tend to start my coaching with solution-focused coaching or grow or one of those kinds of models. So that's kind of how I start. And if that addresses the problem and enables the person to uh, develop future-looking solutions for themselves, then that's fantastic. We don't need anything more. But what we find in coaching sometimes, and I can see that a number of you have been in this situation, is you use solution-focused coaching and you just get the sense that the person is stuck. So they get, or in the grow model, when you're coming to the O, the options, people are really struggling to come up with some options. They know what they need to do, but they just can't somehow develop the pathway for themselves to be able to interact and deal with that effectively. So that essentially is the process by which, okay, so we've had 3 or 4 sessions, we've done grow, we are stuck. Can I talk to you about a different approach? Does this sound like the sort of thing that might be useful? So that's the way in which we would move from a solution-focused or grow model into introducing some ideas that are related to schema. But that's a fantastic question. Thank you very much for asking that.
Any other thoughts, questions that are emerging for any of?
Anyway, there's some very nice comments coming up through the chat. Thank you very much. Just to finally check, are there any more questions or comments that people want to make? Okay, so thank you very much for this opportunity. It's such a delight to be talking to a wonderful group of coaches on the other side of the world in the middle of the afternoon. It's fantastic to be able to share some of the stuff. You can see I'm very passionate and enthusiastic about it. So if you'd like to learn more, please be in touch with me.
Wonderful. Thank you so much, Iain. Thank you, everyone, for your messages and for your active participation. Thank you, Iain, for joining us, even though it's late at night there, and for giving us, introducing us to this concept, because most of us here, this was the first time we'd even heard of this. Yes, everyone, I invite you to connect with Iain. We've shared his details and take this forward. Thank you so much. We'll see you in the next sessions. Have a good day ahead.
Thank you.
Bye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank
Bye.
you. Bye-bye.